Aortic stenosis is the most common type of heart valve disease. It affects roughly 1 in 8 of the population over the age of 75. Of course, this is only going to get worse as the population ages. Sadly, aortic stenosis remains a leading cause of preventable heart failure because many patients remain undiagnosed and are therefore not referred for that crucial timely intervention. Once patients with aortic stenosis develop symptoms, they have a greatly reduced life expectancy. In fact, if left untreated, these patients have a survival as low as 50% at 2 years. As a GP, you are more than likely going to be the first point of contact for most of these patients, and we play a vital role therefore in not only establishing a diagnosis but ensuring that our patients do get that crucial timely referral for intervention. The symptoms of aortic stenosis are quite varied, and they include shortness of breath on exertion, exertional chest pain, reduced physical activity leading to a reduced effort tolerance. These can be difficult to notice, and many patients often mistake these symptoms as just normal signs of aging. The clearest sign of aortic stenosis is the characteristic ejection systolic murmur that you hear, which will radiate to the carotids. When it gets severe, you often also lose the second heart sound, and therefore the first key step in trying to establish a diagnosis is to perform auscultation. If you do identify a heart murmur, it is important to ensure a speedy referral, because establishing the diagnosis early and getting the patient referred for timely intervention is key to optimising patient outcomes. It's important to understand the patient pathway to provide reassurance and answers to questions about what lies ahead. Once you've suspected aortic stenosis with an auscultation, we can refer patients for an echocardiogram to confirm the diagnosis and to give a guide as to the severity. The patients with diagnosed aortic stenosis should then be referred to a cardiologist to oversee the surveillance. Once it's become established that the patient requires an intervention, they will often be referred for an angiogram to have a look at the state of the coronary arteries, and it's now strongly reinforced in the guidelines that all patients should then be reviewed within a multidisciplinary heart team to assess the suitability of the various treatment options, whether that's open heart valve surgery or transcatheter aortic valve implantation. There are 3 important steps to remember. Firstly, please listen for that heart murmur. Suspect aortic stenosis if you hear that classic ejection systolic murmur, and then refer for the echocardiogram to confirm the diagnosis and refer to cardiology once that diagnosis is established.